The first structure I'd like to look at is the plantar fascia. Now, the plantar fascia is a thick aponeurosis tendinous band connective tissue that runs from the heel bone, your calcaneus, to the heads of the metatarsals. These are the ball of your foot. This connective band really is used to act as a shock absorber. It also serves to support the arch in the bottom of the foot. And it's important to note here that this structure also, where it inserts on the tuberosity of the calcaneus, is also where the Achilles tendon has an attachment point as well. And it's actually said in young children that the plantar fascia is a continuation of the Achilles tendon. So these structures between the calf, the Achilles tendon, calcaneal tendon, and the plantar fascia are intimately related. Now, the next structure is the calf muscles themselves. There are actually two main muscles that make up the back of the calf. The first key one we're going to look at is the soleus. Now, the soleus's main action, of course, is to plantar flex the foot, but what's important to note here are really its attachment points. Its first attachment is here on the tibia, posterior surface of the tibia, and it's also attached here there on the posterior surface of the head of the fibula. Now, it shares, along with the plantaris and the gastrocnemius, it does share the Achilles tendon as an insertion point, which goes into the calcaneus here, but the muscle itself extends from the backside of the tibia down to that calcaneal tendon. When we look at its primary action, again, is to plantar flex the foot. It's also important to note that its attachment point, proximal attachment point on the posterior surface of the tibia, is the main muscle used when extending that foot with a flexed knee. This muscle is uni-articulate. It only goes over the one joint, the heel, the ankle. So when doing a seated calf raise or stretching with a bent knee, this is going to be your primary muscle used. Now, the next muscle we're going to look at here is the gastrocnemius. Now, the gastroc, or gastrocnemius, shares the same attachment with the soleus as they merge together into what's known as the Achilles tendon or the calcaneal tendon as it inserts into the posterior aspect of the calcaneus, the heel bone. So it's got the same insertion point on the heel. Now, what's important to note with this muscle is that there are two attachment points, proximal attachment points behind the knee. These actually attach and come from the condyles, the outsides of the femur itself. So this muscle is biarticulate. This means that it crosses over two joints, by two articulate joints. It goes over two joints. So with this setup of having the attachment from the condyles of the femur down to the Achilles tendon, this muscle operates optimally during a straight-legged position. Now, this is important when stretching or addressing calf issues. To isolate out the gastrocnemius, your knee cannot be bent. If the knee is bent, you've changed the area of emphasis from the gastrocnemius to the soleus for that toe raise or calf raise. Also to note that this muscle does have a small role in flexing of the knee because of its articulation behind the knee. All right, so now it's time to zoom into the back of the knee here because we want to look at the hamstring complex. Now, the first muscle of the hamstrings here, and why I want to address this, is how these muscles are closely related. The bicep femoris, or bicep femoris, however you want to do it, has an attachment point at the head of the fibula. And with that attachment point being so close below the knee, these overlap with the gastrocnemius muscles. It does run up the backside of the leg. There's two heads, bicep, two heads. The short one actually attaches to the posterior aspect of the femur. It's called the linea aspera, but it's the backside of the femur. And then the long head actually runs all the way up and has an attachment to the ischial tuberosity. That's your sit bone. That's what you're sitting on right now as you watch this video. So it's a long muscle around the back of the leg, but really for us, it's noting that it is overlapping the gastrocnemius and attaching below the knee at the head of the fibula. Another hamstring muscle is known as the semimembranosus. The semimembranosus has its insertion or its distal attachment point to the posterior aspect of the medial condyle of the tibia. Confusing terms, I know, but basically it's the backside on the inside portion of the tibia bone. Just like the other hamstrings, its origination point, it comes from the ischial tuberosity, your sit bone as well. But again, just to get this visual here, that the hamstring muscle, the semimembranosus, attaches below the knee on that backside of the tibia. So the final muscle to take a look at here is the semitendinosus. So the semitendinosus has a shared insertion point. By shared, I mean there are actually three muscles that come together to merge and form the pes anserinus tendon. It's a tendon that attaches to the medial aspect, the inside of the tibia. Just like the other hamstrings muscles, the semitendinosus originates from the ischial tuberosity, but has that insertion point below the knee. That's sort of the theme I'm trying to push today, is that all the hamstring muscles insert below the knee. All right, so let's zoom back out here and take a look at the complex as a whole. Working superiorly to inferior from top to bottom, what you're going to see is the hamstring muscles. You have your semitendinosus, semimembranosus, and bicep femoris or femoris. You have on the outside, superficial, the gastrocnemius. In deeper, you have your soleus. Those two muscles and the plantaris merge together to form the Achilles tendon or the calcaneal tendon, which should insert into the calcaneus bone, your heel bone. From the calcaneus bone to the ball of your foot, to the heads of the metatarsals, is your plantar. So you can really see the interconnectivity of this group. This is often referred to as part of the superficial posterior line, or when we look at it also as between your foot, your calf, and the hamstrings. That overlap between the hamstrings connecting below the knee really shows how muscles partner together and are one continuing. It's that song of saying, you know, the hip bone's not connected to the thigh bone, but in this case, when we look at this, it's the hip bone is connected to the foot bone. So that is your superficial posterior line or your posterior chromatic chain.